brother started on, that health is a devolved function.
Yes.
And this is a problem that has afflicted, particularly even my county specific. The previous governor chose the Nakumicha way.
Yes.
Where we are saying that doctors, we are not agreeing, fired almost 300 doctors. And that, my friend, up to now, is a problem, to the point that it cost him his seat. That was one of the things that cost him his seat. And let me tell you why that is important context. It's because health is not like any other profession in this country. You look at the doctors and what they are saying. You look at the risk that carries in the doctor's profession.
Yes.
For her to come out and say that she has 50 interns somewhere who are saying they would like to work for free, we would like her. He who alleges must prove. Let her prove and show us who are these. We, as the young people of this country in this political space, we need to ask them the questions on behalf of other youth.
Yes.
Who in this country would want to work for free? In a country where the cost of living is constantly going up, in a country where price of basic commodities is constantly going up,
yes,
I want to see that person who is willing to offer their services for free, when even the salary expectation for the last 10 years has not increased.
That's
So that is either a very unique group of people or a very inaccurate statement from the head of a ministry. And what disappoints me more is that CS Nakumicha is one of the youngest CSs, I think, if not the youngest, in cabinet, in President Ruto's cabinet right now. So for her to represent herself in a youthful way and say that there are people who would work for free, to me that one is completely preposterous. And the second thing you said about the president's voice, I think now this reflects to what the president said some time back. The president says, if I call you and I know more about your ministry than you do, then there is a problem. That is a clear manifestation of the same. Because right now we may not have heard his president's voice, but the president is the governor of this whole county, of this whole country, sorry.
Yes,
Sometimes he has to govern through proxies, and that's why he has sent the head of public service to go and intervene. Because the head of public service is the head of actual government delivery.
Yes,
you understand? So when we see that an intervention from the public service has come into the health ministry, it speaks more about the health ministry than it does the president. That is the first problem you need to look at it from. That if if a minister cannot address her own small ministry she has been given,
yes,
and work on issues and leadership styles of collaboration, not competition, again, you've raised a very salient point. If you say you're going to replace doctors, where are you going to get them from? Are you suddenly going to start importing doctors from other countries to come and serve in a country that already has doctors that are underpaid and overworked?
yes.
But you also must also realize that the points that doctors are mentioning are valid and absolutely correct. If you are working in a space where you're constantly risking your own life, constantly putting yourself in medical danger for the betterment of the public, your compensation should not be a question of, should not be an issue of question. It should be automatic and it should be complete. But now when the CS chooses a position where she wants to take up that we will fire you, or we're giving you ABCD. We saw now the governor of Nairobi has also taken the same stance, that we are giving 12 hours. You're giving 12 hours, and then what happens after 12 hours? 12 hours have ended. What next now? You see, and this is why a lot of leaders need to have advice around them. That sometimes problems are not solved,
yes,
by competition. You can collaborate. And let me tell you an African proverb that is quite popular. That the day a mosquito lands on your testicles, you will understand that you will not use violence to solve that problem.